Okay, then, Parmila, we will start the session. Manjur and Gaurav. So today is 22nd April, passcode 21, free YouTube live session number 16, CPC certification exam, compliance and regulatory common Q&A. So, okay. So our first question of the day, what document is references to when looking for potential problem areas identified by the government indicating scrutiny of the services within the coming year? Yeah, good, Parmila. So now we will go ahead with our session. So see the question on the screen. What document is reference to when looking for potential problem areas identified by the government indicating scrutiny of the services within the coming year? First one, OAG compliance plan guidance. B, OAG security summary. C, OAG work plan. D, OAG investigation plan. So now it is 9:21. We will discuss the answer at 9:24. Yeah, no worries. Just to see the screen. You can see the screen, eh? Can you see the question? So Manjur and Gaurav, can you see the question now? Or Parmela? Okay, okay, no worries then. Thank you, Manjur. So mostly most of yeah, your master Gaurav. Hi Navya, good evening. So Navya Ganji or surname? Navya Ganji Navya. Good name, good surname. Otherwise, your name is Ganji Navya. Great Manjur. Yeah, no worries. Good, good. Mostly you need to see the. So Navya, can you answer this? Hi Sarika, good evening. Okay, good, good. Yeah, go ahead and try to solve this answer. Sorry, question. So no worries. If you don't tell, also no problem. I will explain. Anyway, these are new for most of the coders. Even for me, also new. But as a coder, we need to learn all these things. In live also, these are useful for us. Yeah, yeah. So all about C answer. So that is correct. So I will tell you rationale here. So basically, OIG means Office of Inspector General. So we will check what is Office of Inspector General so that we can learn. See, this is the OIG work plan. See, I told you na Office of Inspector General. So the OIG work plan sets Fourth, various projects including OIG audits and evaluations that are underway or planned to be addressed during the fiscal year and beyond by OIG's Office of Audit Service and Office of Evaluation and Inspections. So we'll see what is the role of OIG. So OIG function is to prevent and detect fraud, waste, abuse, misconduct and mismanagement in the government and to promote economy, efficiency and effectiveness in our agencies, operations and programs. So basically OIG's function is to prevent the fraud, waste and abuse. So you can use these sessions in CPMA exam also. So it is good that all of you know this answer. Yeah, C is correct basically. So what is this? Twice a year, the OAG releases a work plan outlining its priorities for the fiscal year ahead. So for OAG releases work plan for the coming year. Fiscal year ahead means coming year, twice a year. So within the work plan, they will mention potential problem areas with claims submissions are listed and will be targeted with special scrutiny. So what they will do in the future work plan, they will mention all the problems with the claims. Already previous claims they will examine and they will provide remedy to the ahead year claims. So basically they will check all the fraud abuse in the claims already submitted and they will try to solve those claims in the next year. They will provide the solutions basically. Yeah, good evening, Sarika. So I think most of the people wrote correct answer only. Good luck. All are you doing good job today? So next one. What form is provided to a patient to indicate a service may not be covered by Medicare and the patient may be responsible for the charges? LCD, CMS 1500, UB04, ABN. So now it is 9:27. We will discuss answer at 9:30. No worries. Yeah, this is the most common question for medical coders. So usually we'll use in live coding also this term. So now it is 9:27. We will discuss the answer at 9:30. No worries if you don't know the answer also. We will discuss and learn. So as all of you guys know, education is ocean. So every day we need to update our skills. So but ABN is most important thing in medical coding. Yeah, no worries. We will learn even what is not necessary for us. So all of you write your option in the chat box. And Gaurav, are you here with us? So we will wait for one more minute and we will discuss this answer. So good, and encourage your friends to join these sessions. Otherwise, encourage them to watch these sessions. After the session is over, these sessions will be on our YouTube channel. So anytime you can watch these sessions. So now it is 9:30. We will discuss the answer. So basically, what form is provided to a patient to indicate a service may not be covered by Medicare and the patient may be responsible for the charges. So basically, what is the meaning for this? We know that Medicare will provide the reimbursement to the patients. So, but few services Medicare will not provide the reimbursement. During that time, every physician or hospital needs to inform the patient that this service is not provided by the Medicare. You need to pay your own money. So for that, they will take one form, which is ABN. So we will check for what is LCD first. Basically, LCD means local coverage determinations. So basically, LCDs related to the local means every state has some rules and regulations related to ICD and CPT procedures. Like for example, if you have an ICD code, so what happens? For that ICD code, they will keep few CPT procedures. So for that ICD code, physician or coder has to code the CPT procedure. So if that, so basically they will relate ICD-10 as well as the CPT procedure code. So that is LCD. We have two types of LCD and NCD. LCD means local coverage determinations. So basically it is related to local state wise. So NCD national coverage determinations which are related to national wise. Okay. So next one we will check what is CMS 1500. So basically CMS 1500 is used to submit charges covered under Medicare Part B. So for Medicare Part B claims, we will use CMS 1500. So what is UB04? So what is UB04? We will check. So basically UB04 is Uniform Medical Billing Form is the standard claim form that any institutional provider can use for the billing of inpatient or outpatient medical and mental health claims. So it is a paper claim basically. So next one is our answer ABN. So usually ABN means advanced beneficiary note. So basically whenever physician is providing before starting the service, he will take the signature from the patient using the ABN form stating that hello patient, this service will not cover under Medicare, so you need to pay your own money, so that patient can sign the ABN form. So what is ABN? An advanced beneficiary notice is used when a Medicare beneficiary requests or agrees to receive a procedure or service that Medicare may not cover. So this form notifies the patient of potential out-of-pocket cost for the patient. So patient needs to pay the money from his pocket. Yeah. So here our answer is D, ABN. So we will mention the answer here so that it is easy for the people who will watch the session later. First one is OIG work plan. Next one is ABN, advanced beneficiary note. It's very simple. Few services will not cover Medicare. For those services, physician will take this form from the patient. So here, if you write ABN means you need to pay your money. So what Gaurav you are asking from? Farm insurance CMS 1500. So basically CMS 1500 is for Part B claims. So Medicare Part B claims we will use CMS 1500. So we will go ahead with our third question. Under HIPAA, what would be a policy requirement for minimum necessary? Only individuals whose job requires it may have access to protected health information. B. Only the patient has access to his or her own protected health information. C. Only the treating provider has access to protected health information. D. Anyone within the provider's office can have access to protected information. So now it is 9:35. So we will discuss the answer at 9:38. So no worries about the answer. Just try to choose anyone if you feel that is the correct answer. So you can choose anyone, whatever you are sure. So we don't need any exact answer also, as these are new for everyone. These are not common. But HIPAA, most of the guys see. Yeah, good Parmila. So if you are a coder, if you are already working as a medical coder, we need to know HIPAA compliance. So based on HIPAA compliance only, we will follow our coding process. And it is mandatory for each and every company to provide HIPAA training to the coders or employees. So HIPAA is common for everyone. Like it is not only related to medical coders, it is related to people who are working in healthcare sector. Manjur, what is your answer? Sarika, Navya. So you no need to provide any correct answer. Just whatever guess any answer and write here. And Gaurav also. No worries about the correct answer. No problem, Manjur. These are new for everyone. So just after during this session, you need to remember what we have discussed. Yeah. So we will wait one more minute and we will discuss the answer. So anyway, here we no need to search anything. So we'll learn now. So under HIPAA, what is HIPAA? This is very common interview question also. If you go to any interview, HIPAA means Health Insurance Portability and Accountability Act. So the Health Insurance Portability and Accountability Act of 1996 is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. So basically, based on HIPAA compliance, we can't share patient's information to any other person. So without patient's agreement. So we can't share to anyone basically. So here in order to follow HIPAA, we have what are the requirement for minimum necessary. We have, we will check D1, D first. Anyone within the provider's office can have access to protected health information. It is not like that. Anyone can't see the patient's information. So, so D is wrong answer. Only the treating provider has access to protected health information. So this is also wrong. So B, only the patient has access to his or her own protected information. B, that is also wrong. Our correct answer, I think, we will check now. Only individuals whose job requires it may have access to protected health information. Usually here PHI means protected health information. This is also very common acronym for medical coders. First one is HIPAA, second one is PHI, protected health information. So here our answer is A. Why A? So it is the responsibility of a covered entity to develop and implement policies best suited to its particular circumstances to meet HIPAA requirements. As a policy requirement, only those individuals whose job requires it may have access to protected health information. So for example, if you are having, so if you are working in one organization, so that person is a driver. So for drivers, there is no need for the patient's information. So that is the reason answer A is the answer. A is the answer. Only individuals whose job requires it may have access to protected information. So everyone don't need patient's information. Basically, whose job requires patient's information. Hi Prasanjit, good evening. Yeah, A is correct, Sarika. Hi Sampath, good evening. So based on HIPAA, we need to use the PHI of the patient. The individuals whose job requires it may have access to protected health information. So I think everyone got this one. Yeah, no worries, Prasanjit. So after this session, you can watch remaining two questions. Only this is third question only, no worries. So fourth question of the day. Which statement describes a medically necessary service? A. Performing a procedure service based on cost to eliminate wasteful services. B. Using the least radical service or procedure that allows for effective treatment of the patient's complaint or condition. C. Using the closest facility to perform a service or procedure. D. Using the appropriate course of treatment to fit within the patient's lifestyle. So now we have 9:43. We will discuss the answer at 9:46. So basically here they are asking which statement denotes medically necessary service. So you need to identify that. Hello, just chilling. Good evening. Yeah, we have 1 more minute. So basically, these are bit easy only, but we need more concentration in order to understand this. Yeah. So it is 946. Basically, we need to find the medical necessary statement here. So performing a procedure service based on cost to eliminate wasteful services. So basically, eliminating the waste services is not medically necessary. So next one, using the closed facility to perform a services procedure. So that is also medically not necessary. D, using the appropriate course of treatment to fit within the patient's lifestyle. So basically, we will not perform the procedure based on patient's lifestyle. It is based on the surgical ethics. So next, what is remaining? B. So using the latest radical service or procedure that allows for effective treatment of the patient's complaint or condition. So as we have discussed previously, based on the patient's condition and the treatment, we need to decide the medical necessity. So as we have discussed previously, we are having ICD-10 code. Related to ICD-10 code, we have LCDs and NCDs. So they will provide for this ICD-10 CM code, you need to use only these CPT codes. In vice versa, for this CPT code, you need to use only these ICD codes. So these are LCDs and NCDs. So using the latest radical service procedure that allows for effective treatment of the patient's complaint or condition is the correct answer here. So which is medically necessary. So most of the people wrote correct answer only. Not all, most of the people. So as I told you, just you need to understand the question and understand the answer. Yeah, these are bit confusing only, but anyway, these are new for us. If you learn now, you need to remember if you are going to write CPC exam. So next one, when presenting a cost estimate on an avian for a potentially non-covered service, the cost estimate should be within what range of actual cost? $25 or 10%, $100 or 10%, $100 or 25%, and exact amount. So now it is 948. We will discuss the answer at 951. So don't take these Q&A seriously. So these are new for everyone. So but you need to remember whenever you read this. Don't get overwhelmed using this session. Yeah, yeah. Great. No worries. So our time is over. Now we'll discuss. So here our answer is C. So I will tell you why C is the answer. So what is the question here? When presenting a cost estimate on an ABN for a potentially non-covered service, the cost estimate should be within what range of the actual cost? Okay, so here physician needs to mention approximate cost of the non-covered service. So physician has to give the estimation within the range. So here I will tell you answer. So what is the answer here? So CMS instructions stipulate here answer is C. $100 or 25%. Notifiers must make a good faith effort to insert a reasonable estimate. The estimate should be within 100 or 25% of the actual cost, which is greater. So here you need to remember this one. So we don't need much about this one, just you need to remember this is the answer. Okay. So try to remember answer C. Yeah, correct. C is the answer. Just to try to remember. See, we don't need to go in depth about that question. Just try to remember 100 or 25%. So next question. So guys, if you forgot to click on like button, click like now so that it will motivate me for create more sessions like this. Just click on like button if you forgot. So if you feel this session is useful for you, just click on like button once. So I will plan more informative sessions which are useful for you, not which are useful for me. So our next question, which act was enacted as part of the American Recovery and Reinvestment Act of 2009 ARA and affected privacy and security? So now it is 9:53. We'll discuss the answer at 9:56. Guys, frankly speaking, you no need to worry about this. So you need to buy hard this answer. So why means in live coding, we may not use this, but for CPC exam, these are needed. For example, if you write, I think CCS and CIC, CPMA also, they will ask these type of questions. So, but for example, if you take CPMA question, CPMA exam, these are very important. Why means CPMA mostly based on the compliance. So as all of you know, we are providing CPMA training also. So if anyone interested, you can join with us. So we are providing trainings for CPC, CPMA, CCS, CIC, and as well as IPDRG training. So for few questions, just we need to remember the answer. That's enough. We no need to worry about more than that. Like these questions now. So as we are planning to write CPC exam, just for these type of questions, we need to remember the answer. That's enough. No need to worry about more. So today we have published one session related to best tips to find medical coding job in Australia. So if anyone is planning to go Australia, you can watch that session. It is very informative. So I have provided there all the information you need in order to go Australia. And also yesterday I have provided tips to write medical coding online exam without fear. So after the watching that video, you can write your exam without any fear. So basically you are going to write using all AAPC guidelines. So guys, we will discuss the answer here. As I told you, for this type of questions, we need to remember the answer. We no need to for any explanation here. So based on our rationale, here answer is HITECH. HIPAA, HITECH and HIPAA are more common for medical coders. The SSA and PRAC are not related to us. So here HITECH is the answer. So basically, we will learn what is HITECH Act. HITECH is the Health Information Technology for Economic and Clinical Health, which is the act as a part of American Recovery and Reinvestment Act of 2009. So in order to provide privacy and security. So just you need to remember that HITECH. So our next question of the day, what documents assist provider offices with the development of compliance manuals? OIG compliance plan guidance, OIG work plan, OIG suggested rules and regulations, OIG internal compliance. So now it is 9:57. We will discuss the answer at 10 o'clock. So if you don't need answer, no worries. These are new for everyone. So you may not, even I may not find the correct answer. Yeah. Most of the people, I think, wrote correct answer. Yeah, correct. So here, what document assist provider office with the development of compliance manuals? Here, our answer is OAG compliance plan guidance. So using this guidance, providers provider offices will create manuals. So here the OAG has offered compliance program guidance to form the basis of a voluntary compliance programs for physician offices. Although this was released in October 2000, it is still considered as active compliance guidance today. So in order to write compliance manuals, provider offices need to follow OAG compliance plan guidance. So yeah, as most of the people wrote, answer A, that is the correct answer. So well done. Well done all of you. So our next question. Select the true statement regarding ABNs. ABNs may not be recognized by non-Medicare payers. ABNs must be signed for emergency or urgent care. ABNs are not required to include an estimate cost of the service. The ABN should be routinely signed by Medicare beneficiaries in case Medicare does not cover a services. So here you need to find the true answer, means correct answer. So our time is 10:01. We will start the discussion at 10:04. So basically, I am providing you with 3 minutes. Yeah, great. Most of the people right to correct answer. Well done, guys. So anyway, we'll start the discussion now. Here our correct answer is A. AVNs may not be recognized by non-Medicare payers. So correct answer is A. Most of the people wrote correct answer. That is excellent. Yeah, as you know, these are I think most of the common questions for. Hi Priscilla, good evening. So no worries. So basically, ABNs may not be recognized by commercial payers. So other than Medicare, usually we'll call it as commercial payers. So they will not recognize ABN. So basically, we need to understand that ABNs is so as we have discussed previously, ABNs are for only Medicare patients. Only Medicare will accept ABNs, not commercial payers. So we will go ahead with question 9. Who would not be considered a covered entity under HIPAA? Doctors, HMOs, clearinghouses, and patients. Now it is 10:04. We will discuss the answer at 10:05. So for that question, select the true statement to Pramila that the answer is A. ABNs may not be recognized by non-Medicare payers. So basically, as we have discussed previously, ABNs are for only Medicare patients. So commercial payers will not recognize ABNs. That is the correct answer. So yeah. See, now it is 10:06. We will discuss the answer. So guys, try to remember this. Here our answer is D, patients. But here very important and valid point you are going to learn now. So based on HIPAA, covered entities include healthcare providers, health plans, and healthcare clearing houses. So the patient is not considered a covered entity, although it is the patient data that is protected. So patient is not covered as entity here. So here our answer is D. So most of the people wrote correct answer. Well done, guys. So I think you guys are doing very good in this session. So we will go ahead with question number 10. What type of profession other than coding might skilled coders enter? So this is very important for us. A physician, insurance carriers, nurses. B front desk personnel, HR department. C consultants, educators, medical auditors. D none of the above. So basically, if you are a coder other than coding, where do you work? So now it is 10:07. We will discuss the answer at 10:10. So basically, you are a coder, but along with coding, in what type of jobs you can do? That is the question. Yeah, that's correct, guys. So most of the people writing correct. So we will discuss the answer here. So as a medical coder, we can work as a consultant, educator, or medical auditor. So for example, if you are having the dream of business or individual consultancy, you can become a consultant for companies. You can become a educator like us, like me. So I am educating the people, and you can become a medical auditor. So if you want to work like as a job, you can become medical auditors. Yeah, Manjur, here if you are a medical coder, you can work as a consultant. So for example, if you have any company, they need consultant. So if they are planning to get one project, they need consultant from medical coders. So whether can we complete this project within the time or not? So can we do this project or not? So you need to provide consultancy there, and you can become educator. So for example, you can give the trainings also, and in corporate companies, they will hire you as a process coach, and you can become a medical auditor also. So these are the options other than coding. So Gaurav and Manjur, I hope you got this answer now. So question 11. What is the difference between outpatient and inpatient coding? Outpatient coders use ICD-10 CM, ICD-10 PCS. Outpatient coders only focus on hospital services and inpatient coders focus on physician services. Inpatient coders have more interaction than outpatient coders. Inpatient coders use ICD-10 CM and ICD-10 PCS. No worries, Manjur. So, so just it is good for us also. Just as a medical coder, we are confused so far. So what can you do as other than medical coding? So you can work as a consultant, medical auditor also, not a problem. So if you have capability, you can write the CPMA exam and you can work as a auditor. So no need to worry about the answer. We need to try ourselves. Basically, I think this question is the wrong question. So we will discuss the answer based on here rationale. Here answer is inpatient coders use ICD-10 CM and ICD-10 PCS. This is the answer. So, but the question itself wrong. What is the difference between? But there is no difference in answer D also. Yeah, but you need to remember answer is D. Inpatient coders use ICD-10 CM and ICD-10 PCS. So just remember inpatient coders use ICD-10 CM and ICD-10 PCS if you find this question in CPC exam. And C also little bit correct. Inpatient coders have more interaction than outpatient coders. Why means sometimes if you work as a inpatient coder, you need to have interaction with the physician in the process of querying. So C is also mostly correct. But as we need to select only one answer, you can select inpatient coders use ICD-10 CM and ICD-10 PCS. Okay, we will go ahead with 12th question. Who is a mid-level provider? A. Non-licensed PS. PA means physician assistants. B. Physician withholder. C. Mid-level providers include physician assistants and nurse practitioners. D. NPs with bachelor's degree. Yeah, basically Prasanjit, so outpatient people will use ICD-10 CM. ICD-10 CM is common for everyone. So in outpatient, coders will use CPT for procedures. For inpatient, they will use ICD-10 PCS. That is the difference. So here you need to find who is the mid-level provider. In this complaint section, guys, you no need to worry about the rationale. Just you need to remember the answer. That's enough. But mostly you need to keep your concentration on CPT, not on this. Just as a blind, you need to remember the answer. That's enough. Blindly, you need to remember the answer. Yeah, most of the people rate the answer C. That is the correct answer. So mid-level providers include physician assistant, PS, and nurse practitioners, NP. Well done, guys. Most of the people wrote correct answer here. So next one, what are the different parts of Medicare? Part ABD, Part ABCD, Part EFGH, Part AB. So now it is 10:15. We can discuss the answer at 10:17. So now we are discussing question number 13. What are the different parts of Medicare? Yeah, this is very common for HCC coders, even all medical coders. We need to know this properly. Yeah. So most of the people wrote correct answer. Part A, B, C, D. So in future, I will create one session related to all these parts. What covers under Part A, Part B, and Part C and Part D. So next question. E&M services are often provided and documented in a standard format. One such format is SOAP notes. What does SOAP represent? A. Subject to objective assessment and plan, statement, observation, action, prepare, symptoms, objective auscultation, percussion, subject to observation and action. So we have one session related to SOAP also on past quarter 21. So if you anyone wants more information about SOAP, yeah, it is a basic question. In usually, physician will use SOAP formats in progress notes. So not everywhere, but in progress notes, physician will use this. but it is useful for everywhere. Every documentation, if the physician follows this. Yeah, yeah, exactly, Prasenjit. We have Shreddar format also. So soon I am planning to create videos about all these things. But currently we have one video related to this soap. So here our answer is subjective assessment and plan. A is the answer here. So subjective includes what are the patient's symptoms and what is the reason for admission. Objective means, so physician will mention here all the values related to patient's condition like blood pressure, weight, all those things. So in assessment, physician will finalize the patient's condition. In plan, physician will provide what are the action in order to solve or rectify patient's condition. So you need to remember subjective, objective, assessment and plan. So next question. What are 5 steps for coding operative reports? Look for keywords, ignore unfamiliar words, keep the body, ignore pathology reports, only code procedure from the header. Diagnosis code reporting, start with the procedure listed, look for keywords, highlight unfamiliar words, read the body. Highlight familiar words, look for the keywords, read the body, only code what you have highlighted, code procedure only. Next one, read the headers only, look for keywords, highlight familiar words, ignore pathology report, code diagnosis only. So, congrats Deepthi. So, I think Dr. Deepthi. So, guys, tell congratulations to Dr. Deepthi. She has cleared her CPC exam. She previously used to visit or used to practice, participate in our sessions. Currently, 3 people are every time they have participated in our sessions. They have cleared their CPC exams. Today also one girl wrote. So even I am also waiting for her result. So tell congrats to Deepthi. No worries, Deepthi. Are these sessions are useful for you while writing the exam? Thank you, Deepthi. Thank you very much. Thank you. Thanks very much for your appreciation. So basically, we are not looking for any money. Just I want to help the students and the people who are interested to learn. Anyway, congratulations. So that's why. So even if these sessions are helpful for you means I'll be very happy. So my hard work will pay benefits to the students. Yeah, exactly, Deepti. So my request is to after this CPC also just to every week mostly I will try to conduct these sessions every Saturday and Sunday 93%. Wow, wow. Excellent, Deepti. So anyway, you are doctor, it is common for you. Yeah, yeah. Here answer is A. Sorry. Here our answer is D here. Yeah, yeah, okay, Deepti. After this, anyway, this is last question only. So here our answer is B. So first, whenever we see operator report, first we need to check the diagnosis code and we need to relate our diagnosis code with the CPT procedure performed. So first we will find the diagnosis code and we need to check the procedure listed, and during in procedure we need to check the keywords. So that's why whenever I will take the session using the CPT, every time I will tell the keywords. So while writing the searching the keywords in the document, you need to find the keywords and you need to highlight unfamiliar words and you need to search those unfamiliar words in the Google. So if you have the access, for most of the companies will not provide Google, but if you type the answer in the Google, they will provide even few information related to your unfamiliar word, and you need to read the body completely. So first you need to find the ICD-10 code. Next you need to find the procedure performed and you need to read the operator report and you need to find the keywords as well as unfamiliar words. Yeah, Deepti. So today anyway we have only 15 questions, Deepti. So today we have completed our session. If you want to help other students, you can help here. They are asking, can you tell how was the exam pattern? What are things allowed and in computer was that easy to code without difficulty? So if it is possible for you, you can answer this question using the chat. So I will read it for everyone. Guys, if you have any doubts, you can mention in the chat box. So usually we'll finish it by 11 o'clock as these are only questions we have completed a little bit early. So now Deepti is going to provide. So Dr. Deepti, if you are here, if it is possible for you, yeah, go ahead. Okay, exam what not that much easy if you don't read CPT completely. Yeah, that is correct, Deepti. So if you basically CPC means CPT. So most of the questions from CPT only. So because of that, if it is CPC exam, you need to concentrate more on CPT. So Parimela, Dr. Deepti's suggestion is, I have studied really hard, sir. Exam was not that much easy if you don't read CPT completely. So that's why if anyone planning to write CPC exam, watch our videos step by step. So we have started with integumentary system and we have completed with 90,000 series. So you can watch those videos. During those sessions, we have mentioned keywords also. Using that keywords, you can write the proper answer. So Parimala question is CPT theory. Deepthi, handling all books is very important. You should know where are all terms given. They can ask from any topic. Time management is very important. Some questions are long. So Deepthi, all CPT guidelines, Parimala, like coding guidelines questions. Yeah, yeah, correct. So that's why Parimala, every time I will tell you. So whenever you check CPT code in the CPT book, you need to read the guidelines first. So if you know the guidelines, na, you can easily crack the question. Yeah, of course. You need to read the each CPT description one by one. Yeah, correct, Sarika. So that's why Prasanjit, I will tell you the session participants that just this is very easy only. Just we need to compare our question with the CPT description. So that is the most important thing. Yeah, yeah, sure. I think Prasanjit, next week I am going to plan session related to CPC elimination techniques. So there you will find the few concerns. So I will try to clear few of your concerns. Deepthi, anyway, you have passed now. If it is possible for you, just send me your material. So we will use those material to help other students. If you wish, Deepthi, it is not mandatory. Already you have helped us previously. If you wish, you can send. So currently we are using these session documents from one of our students. So they have provided these documents. So Pramila is asking Dr. Deepthi, how many months you prepared? So I think you have my mobile number as well as email ID, correct? So send those. So I will use those documents to help others. So we need to think as a CSR activity, corporate social responsibility activity. Sarika, we have nearly 13 videos on E&M. So, and in our CPC session also, we have one session related to E&M. You can find on, yeah, of course, that is very basic Prasenjit. You need to start from the anatomy first. Why means anatomy is easy compared to all others. So even anatomy, whatever you feel is comfortable, you need to start with that. So it is based on it differs from person to person basically. So some people are comfortable with integumentary, some people are comfortable with orthopedics. So it differs from person to person. Yeah, yeah. 8 mock test practice. Yeah, correct. Parimala, I have already created nearly 13 questions related to ICD-10 CM. So tomorrow onwards, I am planning to start session related to ICD-10 CM. So anyone is interested for that? So can I continue with the CPT? So that is your wish. So do you want CPT or ICD-10 CM? So mentioning your reply in the chat box so that based on that we can go ahead. You want CPT or ICD-10 CM? Yeah, Gaurav, that is correct. The thing is that so irrespective of question length, we need to find the keywords. That is the important thing. So why means few physicians will state one procedure in only 5 lines. So few physicians state procedure in nearly 15 lines. So whether it is 50 lines or 5 lines, we need to find the keywords. Yeah, go ahead and write your option. Do you want to practice ICD-10 CM or CPT? And if anyone wants to go Australia, today we have published one video that is very, very useful for you. Watch that. If you don't go also watch that video, just you will get the idea what is going on the medical coding world. So in our, hi Vishal, good evening. So if you go or not, we need to have good idea about what is going on in the medical coding world. Currently, our Passcoder 21 has videos related to UAE, Canada, USA, and Australia and Singapore. So you can find medical coding related to all these 6 countries. So just you no need to go, but you need to have good idea about what is going on in the outside world. So watch those videos; those are very useful for you. So here I am going to provide our what do you call Telegram link. If you want to have latest updates, you can join in this Telegram group. So and also share this link to your friends. So this group is currently we have nearly 1150 students in this Telegram group. Yeah, most of the people are asking for ICD-10 CM. We are asking for CPT. So let us check. So guys, if you have any doubt, just to mention in the chat box. So we will wind up this session at 10:45. So if you have any doubt, we will continue. No problems. And tomorrow also we have the session. Try to attend tomorrow's session also. Yeah, thank you, Garo. Thank you very much. Yeah, basically these are not common for us. So that's why I have not explained much. So does Dr. Deepti is here now? So Parmala is asking, Deepti, can we highlight key points? So can you answer Dr. Deepti here? I tried to, but not possible. Okay, okay. As it is a online exam, na? Yeah, that's not possible. Correct. But I think, Parmila, you will have one notepad there. So you can write your key points on the notepad. Yeah, correct. You can't highlight on the computer, but I think you will get one notepad. You can write on the notepad. Dr. Deepti, I think you have the notepad, na? Mm. Yeah, yeah. Computer. So, Parmila, you will get notepad and calculator. So on notepad, you can write your keywords. So basically inbuilt notepad, it is not outside, I think so. Along with exam only, you will get the notepad. You no need to open externally. Yeah, Parimala, can we take water or some chocolates? Deepti, only three books are allowed, which they provide and water bottle. So as you told Parimala, books will be provided by them along with water bottle. So you no need to take anything, I think. I think you need to take your Aadhaar card. So any type of government ID proof. Yeah, as per Dr. Deepti, books will be provided by the exam center. Books as well as the water bottle. So based on Dr. Deepti, no food and no beverage is not allowed. So Parmila, you can't take any food and you can't take your water. So only you need to take your ID proof. That's enough. So they will provide the books. They will provide the water bottle. You no need to think. Sorry, you no need to take anything as per doctor. So which location you wrote this exam, Deepti? Okay, okay, Bombay. Great. So even I have stayed in Bombay for 4 years, in Gujarat for 2 years. Okay, thank you guys. If anyone has any doubts, so can we come end this session? So Dr. Deepti, I will post your appreciation in our groups. Nearly we have 4,000 coders in our groups. Like already last week we have crossed 4,000 YouTube subscribers, and combining our WhatsApp and Telegram and Instagram, we have nearly 5,000 coders. So if you don't mind, I will post your appreciation in our groups. So anyway, we did not mention anything here. Just we will mention your name. So my mail ID is Vincent medicalcoder@gmail.com. So all of you try to join in our Telegram groups. So if you want, you can join in WhatsApp groups also. So if anyone wants join in WhatsApp group, send your mobile number to my email ID. I can add you in our WhatsApp groups. So whichever you want. So if you want Telegram, if you want WhatsApp, mention your mobile number along with your preferred group so that I can add you. If you're already in the groups, no need to worry. And also please try to share our groups to your friends. And Dr. Deepti, center exam कहाँ था? सो मुंबई में किधर है दीप्ति सेंटर आपका सेंटर किधर था Andheri. Yeah, I stayed in Jogeshwari, Ambernath, yeah, Ambernath and Jogeshwari and Asanagam. So, Gaurav, results कितने दिन में लगा था? Yeah, yeah, correct, Deepti. Today, you know one girl from our sessions, na? What is her name? I remember, I forgot. Today she wrote the exam. So I asked her what happened to your result. She told that today night she will get the result. And one of our student or participant, her name is Yasin. You know, remember? You remember Deepti? She is also passed in CPC exam. Like last week she told Yasin Muhammad, I think so. Her name Yasin. या आ जाता है वो इसी दिन आ जाता है रिजल्ट्स सो बेसिकली वो लड़की आज सुबह एक एग्जाम लिखा था सो शी इज वेटिंग फॉर हर रिजल्ट टुडे नाइट सो लगता है वो आज दिन पूरा सोएगा नहीं रिजल्ट का चक्कर में और अदरवाइज शी मस्ट हैव इन फ्रंट ऑफ द कंप्यूटर so guys now it is 10:55 so If we have, so we will wait for Parimala. It's everyone choice dear. Yeah, that is correct. Yeah. As Parimala, in doctor also we have different types of specialties. So you need to remember that doctors are preferring medical coding not now. It is for the last 15 years. I know few doctors, they have been doing medical coding for the last 15 years. So it is like personal interest, not because of you have done MBBS or something, you need to work as a doctor. Doctor job is also not that much difficult. You need to spend your whole time for that job. So based on the family situations, everyone can decide whether can I go ahead with the doctor job, otherwise can I go ahead with the coding job. So it is like personal preference. So even I am also receiving few CVs from the doctors. So that's why I told you previously. So there is a huge competition for medical coding nowadays. As doctors also planning to come medical coding. So in order to cope up with this, you need to get update with latest updates. That's why I asked you guys to watch what is going on the world. So you need to know how is the coding process in USA, what is the coding process in Australia, what is the coding process in Canada. So if you go or not, but you need to have good idea. So as because of my channel, so I have good idea about all this process. So even you need to try about all these things. So if you want to survive in medical coding, you need to have good exposure towards medical coding, what is going on exactly in the world of medical coding. So can we stop now? Now it is 10:58. Can we stop at 11? So Dr. Deepthi, I will take few of the your appreciation words from this chart and I will post in our groups in order to motivate others. So there is no harm for you using this. So just motivate others. So nowadays no one is providing free service. Okay, Diti. So good night. So I sent the WhatsApp message also. Please send your material so that we can help others. So thank you guys. Thanks for visiting Fast Coder 21. So tomorrow we are going to do ICD-10 practice session. So all of you ready with your ICD-10 book? If you don't have ICD-10 also no problem. You can use ICD-10 CM data online tool. You can using that. You can give the answers. Dr. DP, you also try to attend these sessions and motivate others. Okay, guys, take care. Good night, all. Bye.